guys start early. I will turn it over to you.
All right. Hi, Brandon and George. Thanks for having us tonight. My name's Bill Rick. I'm the administrative chief resident at Penn State, and I will let our academic chief resident introduce herself.
Hi guys, my name is Alia. I'm the academic chief resident.
There we go. All right, so we're located down in Hershey, Pennsylvania. So the main campus that you would think of when you think of Penn State is up at State College, which is actually an hour and a half north, which is still a reasonable distance to travel. But down here in Hershey, it's the sweetest place on earth, as you can see by our sign up there. It has a little bit about it. It has a low cost of living. So, rent compared to other, areas across the country is rather affordable. Traffic is minimal. I live probably between 5-6 miles from work, and it takes me 10-12 minutes to get there. If you're a family person, we have great school districts. Again, if you're a fun person, we have Hershey Park, and my personal favorite, Chocolate World. I wanted to give the presentation about Chocolate World, but my co-residents wouldn't let me. We have close proximity to other metropolitan areas like Harrisburg, Lancaster, both of which are 20 minutes and 45 minutes away respectively. Philadelphia an hour and a half away, and Washington, DC, and Baltimore about an hour and a half away as well. Hiking, as you can see in the top left corner, is very prominent around here. We have availability for snow sports, skiing, snowboarding. You see the snowboard behind me. It's not actually mine, it's a prop. And we have some breweries and some wineries around. Okay. So here's some of our program leadership. So Dr. Romanowski, she's our program director. Dr. Grafton, our department chair. Michelle, our wonderful program coordinator. And then you met myself and Alia already, the academic and administrative chiefs for this year. And then we primarily have just 3 training locations. So the rehab hospital, which you see in the middle with the rainbow, it is in fact at the end of the rainbow. We have 66 adult beds and 10 pediatric beds. So we get a lot of experience. I think the census tends to run for the adult side close to 60 or so. Pretty regularly. At the medical center, it's it is the largest medical center in central Pennsylvania. So level 1 trauma, 540 beds and 72 pediatric beds. And it's almost always at max capacity. And then our VA, which Alia will discuss with you on the rotation schedule, is where we train our 4th year for some clinic and EMGs.
All right, so just to talk a little bit about the rotation schedule, I'll just go through which ones we do in which year. I did want to make a note that this is actually a product of our program director being super responsive to feedback from the residents. We used to have our first year full inpatient, and we brought up, that we wanted to have some clinic exposure in our first year and then also spread out our inpatient a little bit. So she made that change really fast, I would say within the year. So this is the schedule going forward. So in PGY2, you do inpatient rotations, including spinal cord injury, complex care, which are the medical rehab patients, stroke service, brain injury service, and then we have now added in a month of clinic. And then in your PGY3 year, you do PM&R clinic at the rehab hospital. You also get to do 3 months of EMGs, and it's pretty easy to reach your ACGME requirement of 200 EMGs during the rotation. We also have pediatric rotation, which is inpatient consults and some outpatient. We have a sports medicine rotation, which is outpatient, and we do that in conjunction with family med, and it's a really great experience. You get a bunch of ultrasound exposure and procedures. We also have the pain rotation, which we do in conjunction with our anesthesia colleagues, and again, really great exposure. You get to do procedures there. And then we also have a consult rotation. And also before consults used to be a 3-month block continuously, but because of the feedback that our program director got, she was able to break up the rotation. And actually it used to be only a final year rotation, and now you get to get some experience in your PGY3. And then as a PGY4, you get more clinic exposure, just, general PM&R clinic, which includes all the specialties: spinal cord, brain injury, pain, medical rehab. So you're continuously getting exposure to those during your PM&R clinic rotations. You do the rest of your consults rotation, and then you also rotate at the VA. And the VA rotation also offers a varied experience. You get to get in more EMGs, but you also get to do other clinics like prosthetics and orthotics, as well as pain and general PM&R clinic. And that rotation is evolving. They're trying to integrate even more different types of exposures for us at the VA. And then procedures / wound care rotation, where you get to do procedures both in the clinic and at the Surgery Center. Another thing that we've incorporated is longitudinal research time. We used to have 1 month of research continuously, and it was a bit hard to finish a research project in that time. So now it's split up into 40 half days over the course of residency, which is equivalent to basically the 20 days you would have in a month. So it makes it easier to work on a project throughout. And then we present our research on Resident Research Day annually, so that's a great experience as well. And another thing that our program director gives priority to is QI projects, but we're making it easier to get one done because you actually get to do them in teams with other residents. And we also have a dedicated QI session where you get time to work through the process of QI and come up with an idea for your team. And then just to talk about didactics a bit, this is another thing that we sort of overhauled this year with the creation of the academic chief position. It's an 18-month cycle. We have our didactics half a day on Monday mornings. It's completely protected time. The blocks are probably, the same across the board as other programs. Anatomy is one of the blocks that we do every single year, and we get to do cadaver lab, during which you also get to do ultrasound guided injections for practice. EMG, spinal cord injury, stroke, brain injury, medical rehab, peds, MSK, as well as ultrasound for some hands-on experience, prosthetics and orthotics, geriatrics, rheumatology, and then QI and research. So besides just the general blocks that we have other educational sessions throughout. So every Friday from 12 to 1, we have an additional educational hour during which we do M&M, journal club, and ground rounds, and those all happen monthly. We also have a resident research day, like I said, where everyone presents the research they've done throughout the year. We recently had a career panel where we had attendings from various regions and around us. kind of discussing their experience in private practice versus academic medicine versus different subspecialties. We also have physical exam skills sessions where we get to practice the neurological exam and MSK exam, and then various workshops like wheelchair prescription and exercise prescription. We also do board review questions and SAE questions kind of throughout the year. We'll be having a GATE workshop, like I said, the QI work. And then some other things that we've had in the past are a brachial plexus review session, which we actually do where we teach the medical students. We've done a Botox injection workshop in conjunction with the neurology department, baclofen pump session, case conferences. Those are things that we're going to do this year.
A little bit about our call schedule. It's home call versus, just in-house call. You have call your PGY2 and PGY3 years, but we give the PGY2s kind of a grace period of July, so they can start to understand, the rehab process and, what needs to be seen inpatient and what, or in-house, and then what needs to, be sent out, as we are, by the way, a standalone facility. So that means PGY4s basically have call July of their 4th year, and that's it. They're done with call for the rest of their residency. So that comes out to every 8 weekdays you're on call, every 8 weekends you're on call, and then you're covering just the rehab hospital, unless kind of an emergent consult comes in from the medical center. So on the weekend, that puts you at pager call Friday at 5 p.m. until Monday at 8 a.m. And then you round at the rehab hospital with your thing and your APP Saturday and Sunday. You have to work either 1 or 2 holidays, depending on, how your administrative chief kind of schedules it. And those are listed below. And then, just so you know, for call, you are first call, and you always have an attending available, and they're always receptive to, calling about pretty much anything. Here's a little bit of history about our program. So we've only had 3 classes graduate so far, and then here's kind of where they ended up. So quite a few prominent sports and spine programs, the pain medicine program here at Penn State, which is in the anesthesia department. We just had 2 of our recent graduates end up and match into that fellowship. We have our own brain injury and our spinal cord injury fellowships. And then those who didn't pursue fellowship have gone into kind of a bunch of different rehab careers, both inpatient, outpatient, private practice, academics, which I would say that's pretty good for only 12 graduating members of our residency program in total. So again, I touched on it, but our fellowships in Penn State are brain injury, spinal cord injury, and then we have the pain management fellowship through the anesthesia department. Some of the benefits of our program. So if you're first author on a poster or research project, you pre-COVID would get $1,500 to attend that conference. That would cover, travel expenses, food. Otherwise, everyone gets $750 a year for CME, which, you can buy books, more books, memberships to professional organizations. And then everyone gets $175 4 times a year per quarter for food, coffee, whatever, over at the main hospital. Our program pays for our PM&R membership, our AAP membership, and our AANEM program membership. We get textbooks. Bradham's is in fact one of them. We have some moonlighting options. Typically in the past 4th years, PGY4s have done it. with local kind of practices outside of our institution. Oh, and then we also get this paid, we get to attend a paid board review course. So we don't pay any money to go. We're covered, and we don't have to take any time off for that. So that's fourth year. And then here's a little bit about our, resident life and community involvement. Um, we've gone to Adaptive Ski Day. We have a holiday party. In the top right, you see my birthday celebration. I was not there for my birthday, but they still had it anyway. So I think, outside of the program, we do a fairly good job of, kind of building a good rapport with each other. PGY 2-year, you're in your own resident room, so all four of you, and you really bond in there. I think it's great to have each other to rely on and kind of ask questions with amongst each other.
Bill, I don't want to interrupt you too much. I just so you know, got 5 minutes left. Okay.
Yes, sir. Thank you.
No problem.
And so, given kind of recent events and the climate that we're in, I wanted to also kind of bring this into our presentation. We have kind of a resident-led initiative for anti-discrimination. So we're starting up a committees led by one of our PGY4s, Renuka Rudra. But basically it's, to, identify any areas, of discrimination and kind of, bring them to our attention and kind of going forward to, make sure that, we're a very inclusive program. And I think Penn State, both the program and the College of Medicine have done a really good job of, addressing this. And as you can see, all our attendings kind of signed this, statement saying, we're for anti-discrimination. So here is our contact information. Please feel free to reach out. We have, email or Twitter, except for Alia. Her Twitter is pending. But we're all receptive to questions. If you have questions, you want to throw them in the chat, feel free to do that. We have our other two PGY4s, Renuka Rudra and Sam Willer, are standing by, anxiously awaiting you to type in those questions. So yeah, anything comes up, feel free to ask, email, Twitter, whatever. Okay.